Hello everybody, my name is Catherine Duggan. I'm the Chief Executive Officer of FIP, the International Pharmaceutical Federation. We're a federation that was set up in 1912 based in The Hague in the Netherlands, and I took up this position in June of 2018. Since then, we've established many new initiatives and many ways of recognising our profession, particularly and especially as we have been moving through the global pandemic, something that has affected all of us very, very much. One of the big initiatives that we have at FIP is the way that we can recognise, support and advocate for women in science and education, and that is our FIPWiSE initiative. And it's just a wonderful opportunity for us to be able to recognise some fabulous stars in the profession. We might call them rising stars. And today I have the opportunity to discuss, talk and ask some of our rising stars some questions pertinent to them. Before we get going with that, I'd like my colleagues to introduce themselves today. I have Lingwei and Priscilla. I'd like you to take a moment or two to tell us a little bit about yourselves. So I'm going to start with Lingwei. Lingwei, welcome. Who are you and what do you do?
Hi everyone. I'm Lingwei. I'm from Malaysia, Kuala Lumpur. I'm from International Medical University, and now I'm actually a lecturer and also a cancer researcher in the institute.
Thank you so much. Priscilla, who are you and what do you do?
Hello, thank you. My name is Priscilla Kolibia-Mante. I'm from Ghana. I'm a pharmacist, but I'm also a senior lecturer and as well as a neuroscience researcher at the Kwame Nkrumah University of Science and Technology here in Ghana.
It's absolutely wonderful to have you both here today. May I just say, I feel very, very honoured to be interviewing you. I myself have a huge passion for science and education, and much of my career prior to joining professional leadership bodies in 2010 was spent between practice and education. And last year I was highly honoured to be awarded the Nagai International Woman of Science for the year 2022. So my eyes are always out looking to see who the rising stars in the profession are. I'm going to start with you, Lingwei. What does it mean for you to be recognised as one of the 2022 FIPWiSE Rising Stars?
It's definitely of my honor to be recognized as one of the 2022 FIPWiSE Rising Stars. So I'm really grateful for the recognitions that I have received for my work, because I'm very sure that every other nominees, they are as capable as mine as well. So this international recognition is always a reminder for the hard work and dedication that I have put in during my pharmacy professions. And without a doubt, this award will definitely further motivate me into the journey. So I would like to take this opportunity to thank FIT for the recognitions for this initiative for women in science and education.
It's honestly our pleasure, really, and delighted to have you here today. So, Priscilla, what does it mean for you to be recognised as one of the 2022 FIPWiSE Rising Stars?
For me, being recognized as one of the 2022 FIPWiSE Rising Stars, it's a deep honor for me to be recognized by my peers and senior colleagues for my work on something as important as healthcare, and to have this opportunity to be interviewed by the CEO of FIP is very, very special. It's really humbling to receive this recognition, especially from real giants of our profession. For me, it is an attestation that I may be doing something right, and I'm very grateful.
We're very grateful to have you, and both of you seem very humble. I think it's really interesting as you move through your career that you may not recognise your star qualities, and that's good because it means we remain humble. But I'm going to ask you both in turn, can you let us know what your proudest and most challenging moments in your career are to date that have brought you to where you are? I start with Lingwei, and the same question to you, Priscilla, in a moment.
Right. for me, it's indeed challenging for me to do my PhD with my two little ones, in which I'm also at the same time working as a lecturer during that time. So it's basically a journey of a beginner researcher, a beginner academician, through pregnancy until a beginner mother. So it's not easy for me to juggle in between family, PhD, research, and academic work during that time. But nevertheless, until now, I'm still feel very proud to tell everyone that I managed to complete everything within 3 years. And at the same time, during my candidature of this PhD, I received multiple prestigious national level awards in Malaysia. So though I have faced multiple challenges on the way here, each of them has strengthened me to make a better person today.
Well, you're a real role model, Lingwei, to complete a PhD in that time span with a family. And I think we can draw on this further in the conversation. Priscilla, over to you.
Okay, so for me, I would say, starting with my proudest moment, that would be when I was named an International Rising Talent and awarded by the L'Oréal UNESCO program in Paris in this really grand ceremony. On that day alone, I had over 400 pieces of articles written about me. And the L'Oréal Foundation said that until then, they had never had any awardee receive that much media attention. And it really made me proud to have been the first to receive that much attention. And out of that one moment in my life, I have received so many other recognitions and opportunities in my career. And this happened in 2019. And interestingly, I'd say my biggest challenge happened the following year in 2020. So as a woman in science, my biggest challenge has always been about finding work-life balance. And so at the height of the pandemic in 2020, I happened to have been pregnant around that time. And it was a very eventful pregnancy. So by the time I had gone through the pregnancy and with the pandemic and everything, I had lost so much time and falling so back behind my peers that it took a lot for me to stay on the surface. I think that was my real test of this career. I really struggled with high functioning depression in trying to get back on my feet, but then I managed to get out of it with the help of my husband and my colleagues.
I'm so humbled to hear you both talk so personally about your journey today. And I think actually, Priscilla, you raised something very important, that people who are trying to juggle many things in their life, science, education, or any part of our career, can struggle with very high functioning mental health issues. Depression or anxiety is much more common than we really talk about. So maybe we can pick that up in subsequent discussions after today. I'm going to start with Priscilla this time. What would you change if we achieved gender equity in your field, and where would it lead to, Priscilla?
Okay, so I'm a neuroscience researcher, and this field of research is very highly male-dominated. And this pattern comes from a combination of factors, things like lower acceptance rates of publications for female lead or last authors, lower recognition for contributions from women, lower acceptance rates for funding, or even things like invitation to conferences. And since research is a creative process and collective intelligence is very, very important, especially in achieving useful outcomes for a population, it is important that we achieve gender equity, because that will mean that we would achieve one key ethical principle of research, which is the Belmont principle of justice. Injustice obviously occurs when benefits of research to women is denied to us without any proper reason. So a lot of the time, women's health is understudied as women are almost always underrepresented or even excluded from research. Given an example like neuroimaging studies, a lot of these come from white men, and these results are not very representative of the average woman and may not be useful in providing therapy to women.
That's a very honest observation. And I think, you're quite right. It may take some time to get to gender equity, but let's make some steps forward in that way. And I think, Priscilla, honestly, you are a testament to how you are shifting the dial towards being a woman of colour and a woman with a family and a woman who is leading and shining. This is why you are one of our rising stars. I'm going to hand the same question to Lingwei. Lingwei, it's really important to think about what we would change if we achieved gender equity in your field, and what would that look like?
Yeah, I would think that if we manage to change it, if we manage to achieve the gender equality, it would really allows women to bring in unique perspective to cancer research and also into scientific conversation. So there are examples, for example, women doing research inspired by their own experience as women. But of course, it's possible that men could do the same research and come out to the same conclusion. But often being a woman influence the research people pursue and also the questions they choose to ask as well. So with current level of gender imbalance in cancer research, for example, we are yet to fully exploit the scientific talents among the women. So I strongly believe that if we manage to reach equal participation of men and women in this kind of cancer research, it will probably change the global landscape of pharmaceutical science in cancer and driving more thoughtful innovations and transformation for better pharmaceutical care into cancer management.
It's an excellent set of perceptions, really, Lingwei. I think you're quite right. I think there's something very thoughtful going on here. When we consider gender equity, it isn't just about us being part of the existing workforce in an equitable way. It's about what can we bring to that workforce and what can we bring to the science and education initiatives that you are part of leading. I really love both of your responses. Now, Ethio, it's lovely to see you. I'm so sorry that we are a little bit delayed with you. I'm going to pause my other two speakers and I'm going to go back to the beginning with you. Could you tell us who you are and where you come from?
So my name is Ethio Awad. I'm a research fellow at University College London. I'm originally from Jordan and I moved to the UK about 7 years ago, where I started my master's and PhD and stayed till then.
So wonderful. We're just going to spend a couple of moments with you to bring you up to speed, just so that we're all on the same page. What does it mean for you, Ethio, to be recognised as one of the 2022 FIPWiSE Rising Stars?
So I'm very humbled and honored by this recognition. Obviously, I'm being recognized alongside these great women with their great achievements. And it's great for me that my work is being acknowledged by others. And I hope that my work and my journey would be an inspiration to young women and girls out there to pursue a career in science and pharmacy.
Well, it certainly will be. I think that's the point of having some role models, if you like, for people to look up to when they are starting in their career. And you are all real stars. I think you need to know that. So, Ethio, could you let us know what was your proudest and most challenging moments? Probably it might be the same thing, but maybe there are two different things in your career that brought you to where you are now.
Right. I think I'll start with my most challenging rather than the proudest. For me, the most challenging was getting to start a career in pharmacy, because to be honest, I never really intended to study pharmacy to begin with. And so trying to get to like it and get used to it, that took some time. But the more I got involved in it and the more I got to know it, I started to appreciate the good things about pharmacy and focus on the positive impact it has on other people's lives. And that gave me a new perspective on life and how I see things in a different way. And so that gave me more appreciation for science and pharmacy as a field. As for my proudest moment, I think that was passing my PhD viva. For me, the PhD journey was full of ups and downs, so it wasn't an easy journey, and I'm sure everyone else had the same journey going through their PhD. But one thing I took and came out of it is that I became a strong and proud woman, and that changed me forever.
That's great, that link. And I also think if you don't click completely with your degree at the very beginning, it doesn't mean it's not for you. It means you might need to try harder. And that's a very good message to send to our younger professionals, men and women. So, Athea, what would you change if we achieved gender equity in your field, and what would it lead to?
Obviously, having gender equity would mean that women would have equal roles, especially at leading roles. It will allow them to progress in their careers much easily and much quicker. Um, I mean, obviously nowadays we can see that there are some changes. Women are being given more opportunities than before, especially here in the UK, I guess. There is a lot of changes that are being made to allow women to progress more in science. And in fact, while research may be a male-dominated field, I think women have made significant gains in various fields. And I guess my message to women out there, remember, you're not on your own. There are other people that are out there to support you. And it's not just other women. There are males that will go all the way to support women and give them fair and equal opportunities in everything, in science and in STEM careers.
Great messages there. And I think what I'm getting to, both from Ling Wei, from Priscilla and you, Athea, is that this will form a nice little network for people who are aspiring to become like you three in their careers. And I'm really keen that we don't lose the momentum of you becoming rising stars. So now we're all at the same point. I'm going to start with Ling Wei. What does the next 5 to 10 years look like for you? What would you like your professional achievements to be there?
Well, I wish to expand and advance my roles in pharmacy professions as much as possible in the next 5 to 10 years. And I hope it's just not about the pharmaceutical research, but integrated with practice, education, and also translation of the research finding. So I picture myself becoming more dynamic and confident in the next future 10 years with more knowledge and experience gains in the field. So in addition, I also hope to grow with FIP and also any pharmaceutical professional bodies working towards sustainability in pharmacy and strive to inspire and also support women profession for the field as well.
That's really great. I think we've got you trapped now in FIP, Ling Wei. There's no escape for you now. Priscilla, the same question to you.
Okay, so for me, next year I would have been teaching for exactly 10 years. So for the next 5 years, I'm pretty specific about what I want to see. I'm expecting that I would have become a full professor of pharmacology. But one of my long life dreams is to find a cure for epilepsy. And I am hoping to be able to do that by setting up a research center of excellence at my university that will be doing groundbreaking research and drug development and in relation to CNS conditions. So I'm hoping that through my center of excellence, we would have been able to find cures for diseases like epilepsy and depression and anxiety.
See, what you're doing is, as Ling Wei said, you're bringing your own personal perspectives to your field of expertise. And there's nothing better than that, really, because if you are a woman who has gone through some of those things, you will have the greatest empathy for patients in that area. And I think that really counts for the three of you. Athea, same question to you.
Right. I guess I'm still early in my career, but I am pursuing an academic career. So my future plans are to keep going forward, keep going down that route, and do the research that I love and share my experiences with people around me. Obviously, I would like to inspire young women and young girls and help them to achieve those dreams. But moreover, I would like to make a change in the pharmaceutical field, a change that's big enough to actually be remembered by other people as a legacy. So I want to make a change. I want to touch other people's lives.
Great. I see some real change agents here, and I really wish you the best for the next 5 to 10 years. I don't really need to say that, though, because I will be in very close contact with the three of you. And this is what we do at FIP. We grab you and we keep you very close to us. So I've got a question for you all. I'm going to say, what piece of advice would you give yourself? I know for Ethio, you're early in your career, but at the start of the career you're in today, what piece of advice would you give yourself then that you think others could benefit from? And I'm going to start with Priscilla.
So I would tell myself to have bigger faith and take larger risks. Looking back in my journey, there are a few things that I would have done differently. A lot of decisions which I think I made based on fear. So if I was to do it again, I would ask myself to be braver.
Lovely. So courage. I'm going to count the words, really. Courage, and take a couple of, I suppose you mean kind of informed risks.
Yes.
Rather than, like bungee jumping, that kind of thing. Yeah. So courage and a little bit more risk taking. I'm going to ask some questions after this that are more like discussions amongst the three of you. But Ling Wei, what would be your piece of advice to a Ling Wei early in her career?
As for me, the keyword is to be bold. Yeah. So I know while during my early career when I was a hospital pharmacist, often people ask me, why do you want to step out from hospital and continue PhD with this kind of good pay during that time in hospital? So for them, it was a crazy decision during that time, step out the comfort zone. But what I want to say is just follow whatever you think that is worth to do it and just go for it.
Great. So we have bold and to have confidence, I think, in your decision and go for it. It's really nice set of words here. Colleagues, I think we can all agree there's a theme here, isn't there? So Ethio, I know you are still fairly early in your career, but thinking about your younger self or thinking about yourself, talking to yourself in a few years' time, what would be your big piece of advice?
I think mine would be to be persistent. And even if I do fail doing something, just keep on going. Try something else. Keep persisting until you get it right. I think, yeah.
It's very good advice. There is something here now. I'm just going to open up for a minute or two of discussion, because the three of you are rising stars for your own attributes and your own successes. But there's a lot of commonality here. You can see that maybe you had to make decisions early in your careers that others didn't understand, but you had to do it because something was driving you. I take that from you, Ling Wei, moving from hospital to academia. And then Priscilla, having the faith in the time of the global pandemic to be tenacious, to carry on. And then Ethio, making a mistake. I'm very intrigued by that. There's something about us in our early careers where we think we have to make the right choices, otherwise we're making a mistake. And I think a legacy from these rising stars needs to be that we would come up with some tips for people who are 5-10 years behind you all in their careers. There is no mistake in your career. If you are working hard and learning and developing, this is not a mistake. Maybe it is not suited to you, so you change, but do not always label yourself as having made a mistake. This is very debilitating for our self-esteem. This doesn't mean that we can't be humble and accept where we make mistakes in real life, but do not think that a career choice is a mistake. It isn't. And you can always make it look like it makes sense on your CV as you grow and mature during your career. I really love the ambition I've heard today from the three of you. You've all said where you want to be in 5 to 10 years' time, and you've set the bar high. But I just want to ask you all, if you don't make it there, what will you be telling yourself at that point? If, for example, Priscilla, you haven't made the drugs that cure epilepsy at that point, what will you be telling yourself? And then I think we can just share that before we close.
So I definitely will not be feeling like a failure, because one of the things I have done consciously along my journey is to bring other people along with me. I feel like it is my job to make the journeys of the people coming after me easier than I have had. So even if I do not find a cure, I think that I am going to still have done a very good job at building a very capable army that I know would eventually find a cure for epilepsy.
Yeah, and you have to put a certain kind of, how would I put it, bar there that you can jump, but it is not a failure if you don't achieve it completely. It's to make the journey on the way, isn't it? Ling Wei, what will you be telling yourself in 5 to 10 years' time if you haven't achieved exactly what you've told us that you will?
Well, if I haven't achieved, but at least I try. So the trying step is always the biggest step to step on, and never try and never know. So basically, what we always regret of is always the things that we haven't done. So at least I have tried, I have done it, but whether it succeeds or not is another story.
That's great. And also giving yourself permissions to call trying a success in itself, Ling Wei. This is something we really need to tell our future rising stars, that it's not just the attainment of something, it's the journey towards something that can be part of your success and your journey and also your legacy. So this is really good. Athea, your reflections on that?
I absolutely agree with Ling Wei. Trying by itself requires courage and motivation, and the fact that at least I will tell myself that I've tried, even though I didn't make it, at least I've tried. I put in the effort, I put in the energy, and I put in the courage to go down that path. And sometimes if things don't work, it doesn't, and if they fail, it doesn't matter. They open up other paths, other routes. So what in my mind might be a success in the future, it could be something else is actually a success. You never know.
Yes, I couldn't agree. And I must just say, as somebody who's quite a way through her career, I look back now and think you take a chance on something and that can open up a whole new area for yourself that you didn't know about. And because you've taken a chance, you can also turn back. If you take the wrong turning on a big motorway, you don't keep going on that road. You can always turn around and catch the right road as well. So you have in your destiny the ability to continue on the road you've chosen or to change the road. And this is something maybe our grandmothers didn't have. And we need to be grateful for that. And then I listened to the articulate commentary you've made, the humility with which you've made it. And I have to say, we are very, very proud of our rising stars this year. I look forward to working with you in the future at FIP. There is a lot of space in our FIP house for women like you, and also space for men as well. As you say, Athea, we really need to champion the supportive men that we have in science and education and across the profession. But I would say we need to make a special place for women in science and education to support, to help bring up, to create the ladder for others to become rising stars like yourself. And I'm really excited to see your journeys over the next 5 to 10 years. Please keep in touch. And you are now caught in the FIP trap, which is just an amazing place to be. I've been delighted to have a little chat with you this afternoon, and I just hope that everybody else benefits from your wisdom as well. Thank you so much. Take care, be safe, and have a great time being a rising star.